everyone, I'm Dr. Domingo and welcome to my vlog. So today I'm going to talk about antibiotic resistance. So we use antibiotics to treat bacterial infections, and antibiotic resistance is when the bacteria changes its structure so that it's no longer affected by the antibiotics, so that way it can continue growing and remain untreated. So antibiotic resistance is one of the biggest threats to global health at the moment. It can happen to anyone at any age, and it can occur naturally, but misuse and overuse of antibiotics in humans and animals is accelerating the process. So the difficulty with antibiotic resistance is that it increases hospital stays, it increases your medical costs, and it increases your mortality, so your chances of dying, because it's more difficult to treat the bacteria. So here's just an example. You have a middle-aged lady, 60 years old, that goes to see a GP, complains of going to the toilet a lot, her urine burning and having discomfort, and a bladder infection is diagnosed on the urine dipstick. So the doctor puts her on a first-line antibiotic and sends it off to the lab to make sure that they are treating the right infection. So the specimen comes back from the lab. The bacteria is resistant to this first-line antibiotic that the doctor prescribed. And the bacteria is only sensitive to an antibiotic that needs to be given in a drip. So now this patient has to go to a medical facility or hospital where she can get IV treatment. So while she's there, she develops a pneumonia. She now needs chest x-rays, she needs physio, and she needs to have the urine tested again to make sure that the bacteria, that the infection is being cleared up. So once she's discharged, she's now obviously not in the same health. She's a little bit more frail because she was in the hospital for 2 weeks. And yeah, she's just worse off than she was before. So if this was a normal sensitive bacteria that we could have treated with the first line, this lady wouldn't have had to go to hospital. She would have been on 5 days of first line antibiotic and she would have been fine. So this is the implications of, this is an example of the implications of antibiotic resistance, and often the situations can be quite worse. So resistance is higher in areas where people can purchase antibiotics without a script. People tend to self-diagnose and insist on antibiotics, and that's not good. So what can we do to reduce resistance? So only use an antibiotic when it's prescribed by a certified health professional. Don't insist. If your healthcare provider says you don't need the antibiotics, take their advice, don't insist on that. Always follow the dosing instructions and finish your course. A lot of people, if you have a 5-day course, they finish 3 days and then they stop. No, you don't do that. You finish your course. Don't ever share antibiotics or use leftover antibiotics. It's something that people tend to do. They will not finish their course and then, no, don't do that. And then to just practice general good hygiene to prevent infections, because that's the best way of preventing bacterial infections. Practicing good hygiene, that way you don't have to use antibiotics. And then I'm briefly going to talk about antibiotics in agricultural use. So antibiotics are also used widely to supplement as growth supplements for livestock. So it's said that by giving the animals antibiotics, they are healthier and they yield better quality product. So these antibiotics that are given to the livestock, we ingest when we eat that meat. And in the same way, if these animals develop resistant bacteria, that can also be transferred to us when we eat that meat. So what are the take-home messages? Antibiotic resistance is a huge global threat at the moment. Only use antibiotics when it's advised by your healthcare practitioner. Please don't force your doctor to prescribe antibiotics unless they feel it's necessary. And when using antibiotics, finish the course. Practice good hygiene in general to prevent any bacterial infections, and watch the meats that you eat. So tomorrow, Pamela Pillay, the dietitian, she is going to talk to us about the antibiotic use in livestock and what we can do and what we can look out for when we purchase our food and our meats. Thank you for listening. Please share this vlog with your friends and family and subscribe to my YouTube channel. Thank you.